Will I be awake during this procedure? So with our anesthesia and sedation, we can deliver enough that you feel like you're relaxed but awake during the surgery, or we can give you more and safely give you more, as much as you want. And you can be sleeping through the surgery too if you choose to. And that's safe to do. It in my opinion, makes the surgery more controlled, when there's, when the patient's sleeping. Uh, Now, the downside of being sleep during the surgery is your driver may have to help you to the car and get you home safely, because you're going to be pretty out of it and pretty sleepy after the surgery as well. So it puts a little bit of responsibility and effort on your partner or your driver. But if that is okay, then feel free to take more, and get more comfortable during the procedure. Again, it's very normal to feel a little bit of anxiety before the surgery. I would expect everybody to feel some level of anxiety. I think it would be very strange to meet a patient who didn't feel, who felt very comfortable going to the surgery. Even patients who've had eye surgery, LASIK, retina surgeries, are apprehensive when they show up for surgery, and that's expected, and that's what our medicines are for. So you can be awake during the surgery. When you're awake, you should be at least relaxed, and I will coach you through the surgery as we begin, and I'll let you know what we're doing at every step of the way. You'll be able to hear my voice. I will just be inches away from you. And I'll let you know what we're doing, what to anticipate feeling, pressure, cold water, such things, bright light coming on ahead. That tends to be the most challenging part of the surgery is the bright light from the microscope. I've met surgeons who operate with very little light, but personally, I want to be able to see everything. I feel most comfortable when I can see everything all at once. But there are very gifted surgeons who can operate almost in the dark, but I'm not sure how they do that. Anyways, expect the light to be bright, and so because of that, and all these new sensations, I recommend for you to take some sedation, and not to be brave about it and take nothing. That's really, in my opinion, a bit more risk than you want to take, because we want everything to be well controlled. But if you don't take anything and you suddenly feel very scared, and we're in the middle of your surgery, not to say we'll have a complication, but it just makes things a lot more challenging, and you're going to feel very, very uncomfortable. So do take the medicine, and this will be an extremely easy and comfortable experience, and take as much as you need. You can be asleep during the surgery if you like to be, but most people just take the standard dose, and they do just great. Thank you.